Hi, how are you guys? I'm sure you must be in a pink of a health. Well, we are welcoming you for another session today. To be very honest, this session is specifically for those candidates, those students who have just booked their exams or whose exams are around the corner. Well, let me tell you one thing that whenever a student or a candidate is giving an examination, couple of days before the examination, we start having some kind of anxiety. We have some kind of scary part, and we have a lot of butterflies in our tummy, and we don't feel hungry anymore. We don't feel thirsty anymore, and we are so scared. So this happens that when you are having your examination, the nervous breakdown is very, very common. But today's session is specifically to help you guys not to have a nervous breakdown and how to control yourself. And last tips and tricks, last points of the tips and tricks before the examination. So let's not waste our time and begin with it. Before we start, let me welcome you on the behalf of Dynamic Academy, which is the biggest e-learning recruitment company for the healthcare professionals. I know you must be very excited to be part of this family, and a lot of students, they feel so happy. They tell us about our experiences. They share that how much they have been helped by our trainers, and all the mock tests and all the class tests they have been giving them. They feel very happy and glad. And not only that, we are also helpful. We are also thankful for you guys that you have given us such a great opportunity to work with you. Now, before we start, let's talk about OET. Let me give you a small overview of OET. We know OET is, the full form of OET is Occupational English Test. As this test is focused for the professionals of the healthcare only, the word OET, as I mentioned, the full form is Occupation and English. These two words are the ones that is explaining more about the test. Like here, in occupational knowledge, they are going to test means they're judging your occupational knowledge, and in the English test, they're judging your English. So whenever you are judging someone on language, the more focus will be on the grammar and the vocabularies. Not only that, as we have to mention you earlier, these OET examination is focused only for the medical professionals like nursing, medicine, dentistry, dietitian, occupational therapist, speech therapist, veterinary, physiotherapist, and more. So you are lucky ones that you have your own examination. Let me tell you, many people ask me question, Ankita, we're not sure if the OET is, recognized in the country where we have a desire to go. Like if I want to go to UK, US, is it eligible? Is it recognized? Yes, it is. You can easily, you can easily give an OET examination, and you can, without any trouble, you can migrate to Australia, New Zealand, UK, US, Ireland, Dubai, Cambodia, and Ukraine as well. So all the best for your future. As you know that OET is a test where they are judging your occupational and English test. Whenever you're judging a person on language, you will be judging them on the 4 different modules: listening, reading, writing, and speaking. Yeah. So let's focus about all of them. Let me give you a small overview of all the 4. As you can see that the starting of the test starts with listening. Listening is total for 45 minutes of time, and total 42 questions are there to be attempted. This listening part is divided into 3 parts. Part A, where 2 conversation between patient and a doctor is there. Part B, where conversations between the medical professionals are mentioned. And Part C is like where one presentation is given by one single person. So in listening, we are focusing on only about how to do the listening, how you're able to listen to the audio and write down the answer. Next test is reading. Reading is for 60 minutes of time. Again, 3 parts, part A, B, and C, where total questions are 42. As you know, in reading, we have done in school days unseen passages. This is just like that, but the reason is, the only difference is the passages are related to your medical profession, and you can easily, read the paragraph because it's related to your profession. Like topics could be broken fractures, alcohol, abuse, or paracetamol poisoning. So topics are related to your medical professionals only. Third test is writing, where you will be given 45 minutes of time again to attempt one letter, especially a discharge letter of patient. Either you're referring the patient to the doctor, or you're handling over the patient to the nurse or a community center. Last but not the least is speaking, where you will be having a role play. You'll be given 2 different role plays, and you have to deal with the examiner thinking that he is a kind of a patient, and you have to have to help them. You have to speak and do the conversation just the way you're doing in your professional official hospitals. All these tests, they are judging your English as a grammar and vocabulary, and not only that, they are also judging your medical knowledge, how well you have the knowledge of the medicines, how much hold you have on the topic of the medications you are able to manage. The marks here are not in the number form, but in the grades form. A, B, C plus C minus D, and E. Majorly, if a student is there, they ask you that whichever is a basic percentage or what is the basic marks, many students will say triple BC. Well, you're right. Triple BC is a correct answer, and that's a minimum. You can say it's an average marks, but we always ask our candidates to focus for A. Why not? Give a try to A. I mean, you deserve A, and you can do it. Sorry. So this is a small overview of OET. Now let's jump on listening. As I mentioned earlier, in listening module, you will be given 3 modules. There will be 3 parts in listenings. Part A, Part B, Part C. Part A consists of 2 audios. Total questions 1 to 24. In 1 to 12, you will be hearing an audio or like conversation of a consultations, or you can say you'll be hearing a kind of a conversation between a patient and a doctor, where they are going to discuss about the condition of the body, or if any other disease anyone has, or any kind of pain they are having, any past history, medical medicines they are taking. So here the conversation will be focusing only on the conversation between doctor and the patient. These audios will not exceed more than 5 minutes. You will be given question papers in your hands, which will be in the form of fill in the blanks, where your job is to listen to the audio and fill up with the correct word. The many times I've seen students making mistake is like whenever they are writing, they are listening to the audio and they are writing the answers, they may commit mistakes by not writing the same word which has been mentioned in the audio. Somehow, I understand that not every time we are able to crack all the answers. Sometimes we miss the points, sometimes we miss that words. But instead of, if you are missing that points or you're missing the words, don't worry, don't panic. I understand, we suggest you to follow the synonyms. But to be very honest, let me be very straightforward with you. Try to enhance your listening power. Try to catch up the exact word which has been given in the audio and put it in the blank. Yes, I agree. If you have lost an answer and you're still confused, you can give a try to synonyms. Not all the time the synonyms are are rejected, but synonyms should be limited in numbers. Now, this problem I have seen with the students, that when they are listening to the audio, they say the audio is very fast, or you are not able to catch it, or you're not able to understand where the answer went away, and they get scared, they get confused. I know it's very normal for a human being that when we are having an answer, when we are giving an answer, and we are not able to see where the answer is, where the blank is, or we are not able to find out the answer or the word which is being asked in the blank, we end up getting panicked, we end up getting confused, and because of which we even lose the track of audio, which is actually going on and on. The audio is not stopped, and we lose another answer. Whenever you lose an answer in audio, you're not able to hear it, don't worry, don't panic. Read it, leave it for a minute. Remember the audio is running only for once, and it is continuously running. So whenever you're listening to the audio, try to leave that answer which you have missed, forget about it, continue with the next answer. Later on, when you will be given last 2 minutes time to check your answers, you can update your answers. Part B of the listening, you will be given 6 different questions, and each question will be given 1 audio each, where the audio will only be for not more than 1 minute. So again, a very small audio will be given to you about a short workplace extracts where 2 or 3 people are discussing about some kind of condition. The doctors and nurses are discussing about the workplace issues, or they're talking about medications, or they're talking about some machinery. So here in part B, you will be listening to the questions, you're listening to the audios related to each question. Whenever you are listening it, remember that these type of questions mostly ask about some detailed information about the task, or they talk about in-depth gist of the audio and what was the purpose, what was the reason that all the healthcares were discussing about the audio. So whenever you're listening to the 6 audios, try to keep your ears up. I have seen a lot of students who try to attempt the task and they feel that they're not able to get the correct answer, because the answer B in part B, you get multiple choice questions where you have to pick the correct answer or correct opinion. And they get scared and they are like, we don't know what is correct one and we are confused. The audio has spoken all the 3 options, and which one is the correct? I get panic. Don't worry. Always remember, the listening can be done perfectly when you are giving your 100% attention. Secondly, in listening, I would suggest you that whenever you're doing a listening task, you guys have to keep on practicing with the listening while watching some videos on the healthcare professionals and, trying to talk to your friends and listen to some audios in English. We provide them with all the links and we help them in the classes also with the listening practice. The more you are able to practice, the more better opportunities for you to understand and how to crack such kind of answers. Not only that, when you're reading the options, try to see which tense they are talking about and try to match up with what tense the audio is conversing was going on. So like this, it will be best for you if you're having a strong hold over your ears, your listening power, you'll be able to crack this very easily. Part C. This is actually the scariest part where many students get scared and they're like, Ankita, we are not able to do it, or we are not able to catch the answer. The reason behind part C, it's that it is like a big presentation conversation for 5 minutes. Only one person is kind of giving a lecture and talking about this condition, about some medical professional condition, and she's, giving different views about different authors and different medications. So whenever you're listening to part C, it's here you can see that this audio is going to be for 5 minutes. So the lengthy audio is running up and you have again multiple choice questions. Whenever you're listening to the conversation, which is like a presentation or an interview, we have to understand again that it's going to be a lengthy one. The audio is not for 1 minute, not for 2 minutes. It's going to be a lengthy audio where we have to keep our concentration very on the top. If I'm not able to keep my concentration, I might lose a couple of answers and that will be a trouble for me. It's not easy actually, Patsy, where I've seen a lot of candidates coming up with the complaints that they find it little scared and they're like, Ankita, we don't know how to manage it. It's a little bit scary and the confusing is also there that the girl or the audio or the conversant, the person who's speaker, he speaks very fast and we are not able to, by the time we catch it, the audio is already over. So such kind of common complaints are very general. Don't worry. Whenever you are listening, remember you have the question paper in your hand. You will be given, 60 to, you'll be given 90 seconds of time to read the questions. When you're getting such time to read the questions, you can get an idea what exactly are you looking for in the audio. What exactly is the point you must look for the answers in the audio. And not only that, you must remember, sometimes when candidates say that, Ankita, can we use the abbreviations like small BP or any kind of a common abbreviation? To be very honest, yes, you can. You are allowed to use small kind of abbreviations, a small kind of, again, it should be very common, not very something which is not known by a lot of professionals. You have to be using it in a common way. Here, many times I've seen when the author or when the speaker is giving the audio, many times students make spelling errors. Spelling errors is another faulty point that you guys can lose your marks. For this, we always ask our candidates to keep the knowledge of their OET medicines to be updated. Keep them studying. If you are not able to remember what the spelling was, was it K or C, whatever comes in your mind, go right ahead. Let me tell you one thing, that examiners will not be cutting your marks very severely. But if there is a one alphabet mistake, or if there is just a small minor mistakes in spellings, they can somehow still give you points. But we suggest all the students to be updated with the spellings. Many times I've seen students asking me question, Ankita, for getting for getting marks like B, grade, how much should I get out of 42? To get B grade, you need to get 30 out of 42 marks. So it means that you have to at least get 30 correct answers out of 42. Now, this is a little scary for them, that they find that A, we are able to do it. In B also, they get a little bit confused, but somehow they're managing it. And with the C part, where there are 2 different conversations and 6 multiple choice questions each, they again get panic attacks. They are like, oh, what if we lose answers here? What if we are not able to answer here? Don't worry. One thing you can do, if you have not able to find the answer, you can use your previous knowledge to answer that question. Well, let me tell you one thing, that for the journal tips and tricks we ask our candidates to follow is, again, as I mentioned, we ask you guys to, be familiar with the critical vocabularies. We always ask you to read the questions before the audio is starting to give an idea what exactly you're looking for. But if the audio is not clear, you are right to talk to the examiner. Tell them, sir, please check the audio, or please check my microphone. It's not right here. But remember, the audio is going to continue without stopping. If you lost a question, you lost lost an answer, don't worry, don't stay, keep on moving. Always practice while listening OET podcast on daily basis, and try to use the words that fit in questions. Again, try to use the same words we are using in, you can say, in the audio. Synonyms should be there, but try to use the exact word used in the audio. And last but not the least, practice on daily basis, because the more you practice, the more better opportunity for you guys is to succeed. I hope I have cleared your listening doubts, and let's hope that you clear all it very well and get B, and not only B. Why should we focus on B? Let's go for A. Okay, very well. Let's take a 2-minute break.
Hi, good evening. I am 𝗘𝗫𝗔𝗠 from Dynamic Health Staff. In this short video, I'll be giving you a brief description about OET reading as we all approach OET exams next week. Here, I'll be giving you some tips and tricks which will definitely help you to get a very good score in OET reading subtest. All of you know that this reading and listening subtests are common to all the health professionals, and the total duration is 1 hour, and there are 3 parts in each part, A, B, and C. And A part you get only 15 minutes to complete, and B and C together you get 45 minutes, and there are a total of 42 questions. Now, let's see each part in detail. In part A, you'll be getting 4 texts which are related to a common topic. And here you will be reading very fast to get some specific information. And there will be 20 questions total, and you get only 15 minutes to complete this part A. So here the candidates find the time constraint as the most challenging factor. Then coming to part B, here you will come across 6 short extracts which will assess your ability to find out the gist, purpose, or overall idea of the given text. And with each extract, there will be 1 multiple choice question and there will be 3 options. In part C, you can see 2 long passages that may be taken from some of the journal articles or some textbooks, etc. And here you will be reading for detailed information, and with each extract there will be 8 questions with 4 options as answers. Let's see each one in detail. In part A, there will be 20 questions and there will be 3 types of questions. They are matching questions, short answer, and sentence completion questions. In matching questions, certain information will be given and you need to find out in which text that particular information lies. Here, when you try to find out answers for part A, it is very important for you not to try reading the entire text. You need not read every single word. You can just glance quickly to locate specific information. For that, first of all, you can just go through each text, just go through the titles, headings and subheadings. Then if some pictures are given, the labels, diagrams, or words in italics or bold. Then coming to short answer and sentence completion questions. In short answer questions, you need to read the question carefully. Here you will be answering questions and there you need to look for the question word, whether it is what or why or where or when. Depending upon that, you can understand what kind of word you will be searching for. Here you need to read the question carefully, underline the keywords, that is very important, understand the meaning of the question, understand the kind of information you are searching for, then find the relevant section where the answer is likely to be. So here, as I have already told you, you can just go through the 4 texts within 2 to 3 minutes, not more than that. Then you need to come to the questions. And here again, you need to remember that you try to focus on the number of correct answers you find out instead of trying to complete all the questions. That is very important. Then let me talk about some tips for scoring in part A. First one, pay special attention to the titles of the text as they give clues. So whether the text contains information regarding the courses or management or some research extract or some information regarding a disease condition or any other general information, any medical information. So you need to understand what is written or what is the content of each extract. For that, you can just use the titles to get some clues. Do not spend too much time on one question if you can't find the answer. This is very important. As I told you earlier, here the time constraint is the main challenge. So don't stick on to a particular question. If you find that you are not able to find answer for a particular question, go to the next. Record your answers correctly. This is very important. Use the same form of the word and check it is spelled correctly. Because here in reading part A, you will be just copying the words from the given text. So you cannot make any spelling errors in reading part A. Assure the sentence is grammatically correct. This is also very important, especially in the sentence completion type of questions. Do not rely on your medical knowledge. You are supposed to find answers from the given text, not from your medical knowledge. And the subtest is focused on language and not on your knowledge. Remember this. Now, let's move on to part B. In part B, you can see 6 extracts, each about 100 to 140 words. Each extract with 1 MCQ with the 3 options. And here, they will be assessing your ability to recognize main message, purpose, and details of workplace communication. And you will be getting extracts like emails, memos, notices, guidelines, instruction manual, or some policies. Now, here, the tips of scoring. Here, you know that an extract will be given, a question will be there, and there will be 3 options. So here, what you can do is, first you read the question, then go to the text. Keep the question in your mind, read the question, read the text to find out answer for the question. And you get some information as the main idea of that text. And come back to the questions, come back to the options, then just see whether that particular information matches any of the options. Think of the type and purpose of the document and understand the context of the extract. When reading the question, think about whether it is asking the main idea, a detail, or the purpose. Underline important words or phrases which will lead you to the quick answer. Focus on the meaning of the extract rather than looking for the words from the answer options, because many times it will be paraphrased. That means a similar word will be used, and if you are searching for a particular word, you won't be able to find that word in the extract. Now, let's move on to part C. In part C, you will see 2 long articles, each with about 800 words. Each article will contain 8 questions having 4 options. Here again, you will be seeing multiple choice questions. And here, you will be reading the text for main points, attitude, or opinion. Now, tips for scoring. Here, you will be given a long passage, and it is better directly go to the questions. And before that, what you can do is you can just number the paragraph so that when you come back, it will be easier for you to locate a particular paragraph. Then again, here the tricks or the strategies may be different, and you can utilize your own strategies, but still you can search for some words which are written in bold and underlined, because there may be some questions related to that, some vocabulary questions or reference questions. Then certain questions will be related to the opinion or argument, or so these are the different types of questions you will come across. Attitude, opinion and attitude question. Main idea questions. For that, you need to understand the summary of that particular paragraph. Then vocabulary and reference questions. Now, try to understand the meaning of the paragraph. That is very important. Even when you practice reading, this is very important. answer the questions in the order, because the questions also will be given in the order and order of the paragraph. It will not be given in a jumbled manner. So if you are trying to find out answers in the order, it will be easier for you. But still, if you can't find answer for a particular question, you can skip the question and you can go to the next question. Here also, do not stick on to the particular question. Don't spend too much time on one question. Then practice using paragraph summary technique. Time yourself doing sample test. This is very important. If you haven't done it ever, now it is your time to start it today itself, because that is very important. Time management is very important, especially for part A. You must be able to finish it in 15 minutes, and part B and C together you will get 45 minutes. And some people find it difficult even with 45 minutes. So it is very important to practice time management. These are the tips for scoring. Then some general instructions about the skill of reading. Develop a habit of reading. Read with interest. This is very important. Improve your vocabulary. You can start it today. Try to improve your vocabulary. Develop your understanding. Practice speed reading. Focus your attention. Sharpen your concentration. And above all, take it as a life skill development. Thank you.
I know I have been giving you a lot of tips and tricks about listening earlier. Now we'll be sharing about speaking. What troubles I have seen a lot of students face while having their speaking. In speaking, you will only be getting 20 minutes of time, not more than that. So now all the tests will be completed in 20 minutes. In this 20 minutes test, we are divided into two different categories. In first category, or part 1, we'll be having a warm-up session, questionnaire session for at least 5 minutes. Now, what will be the warm-up session? The examiner is going to ask questions about you, your likes and dislikes, and about your profession. And then the part 2 will be, you'll be getting 2 different real-life role plays, where you'll be getting 3 minutes time to prepare about each role play, and for next 5 minutes you have to continuously converse with the with the examiner, thinking that he is a patient and you are a medical professional. Many times people ask you what type of warm-up sessions are used. So we have shared the list, and we always use the commonly asked questions. We have made them down, and we always discuss them with our candidates. They always start off with asking your name. They will ask you to introduce yourself. They will talk about your hobbies, your likes, your dislikes. They can even ask about why did you choose the medicine profession? And they will ask about why you're attempting the OAC examination. What are the challenges you face in medical field in your country? Why, if you're, which country are you planning to migrate, and what is the reason behind it? And what are the qualities do you think the medical professional should possess? And about what advice you'd like to tell to the future nurses, and what is your daily schedule going to be? Now, whenever you're doing this warm-up session, remember to give a proper 1 to 2 minutes answer, explaining about your condition, explaining about giving them the answer with a little bit supporting of the answer. Suppose they're asking you, why did you choose medicine as a profession? Many people say that it's because of money, or we can get good salary. But that is not enough, as we are aware of that when you're choosing for an examination, when we are choosing for a profession, we always see what skills are important, what the qualities we have that we want to comply with that skills and comply with those actions and activities. Always remember, whenever the speaking is done, it is going to be done face to face. So you have to keep your calm on the strong. You have to keep your hold over yourself. Relax yourself and calm yourself. Don't need to worry what will happen. Many times I've seen students, when they become comfortable with the trainers, and when we give them a new trainer, for having a test, they get a little nervous and scared, and they end up making so many grammatical errors. Not only that, whenever you're speaking, try to talk to the examiner with a smile. You don't need to be rude to the examiner just because he's the one who's not judging your answer. It doesn't have to be like, why should I smile at him? What's the reason behind it? No. First impression is always taken as the last impression. So it's good if you're having a smile with the examiner. Remember one thing. Whenever you're speaking, try to speak very clearly. Many times I have seen people, while they're speaking, sometimes it happens that we fumble up, or sometimes it happens that when we are speaking, there is some kind of, miscommunication. It happens, and it's natural. But try to have your voice and words, each and every word clearly pronounced, and it should be properly audible. Your voice has been recorded, so it has to be properly done. Not only that, always carry your passport registration number while you have gone for the examination, and try to have a good eye contact. That not only helps you to build up confidence, but also makes you feel more relaxed, and you can understand what the examiner is expecting you or what question he's asking you. Next will be the 2 different role plays. In these role plays, the examiner is going to, give you a kind of a piece of paper where the backstory will be mentioned, and here you have to read the backstory of the patient, and then you will be giving you 2 to 3 minutes of time to prepare. What exactly is the preparation time? You have to make the set of questions and the notes. What are you going to ask the patient? What are the doubts you're going to point up? And what medical professional and what knowledge you're going to, whatever answers you're giving to the patient. And then for next 5 minutes, you have to do the conversation. Many times I have asked, students have asked me, Ankita, what if in the cue card, in the role play card, the name of the patient is not mentioned? What should I do? Majorly, it's okay. You can ask the invigilator that, sir, what is your name? May I confirm the name of the patient? You can ask like that. Not only that, if you're having a role play, even then also you can ask the patient that, sir, may I confirm your name for my file or for my record? You can easily ask. It is okay and it's allowed. Now, remember one thing, your communication skills and your linguistic skills are the ones playing a major role. To get B grades in your list, in your speaking session, you have to get at least 5 points out of 6 in your linguistic skills. What exactly is linguistic skills? That how good your vocabulary and your grammar is. And 2/3 of the marks has to be used toward your communication skills, where how well you're communicating with the patient, how well you're dealing with the patient, how well you're giving them the answers, or you're questioning him, or you're taking up the points, or you're telling the patient what exactly is the trouble he or she is suffering from, how well you are conversing the conversation back to the patient. Many times we have seen that whenever the conversation, whenever the students is given a cue card and the role play card, and then they start speaking, they would, instead of introducing themselves, who are they would start saying that, yes sir, what's your name? I know that you have suffering from this disease. They start like that. Never ever start a conversation even without introducing yourself. It would be better introduce who you are. You can say, hello sir, my name is Jane. I am a community nurse. I'm a head staff nurse. Okay, how can I help you? What can I start with your name? Can I confirm your name and age? You can have to start with a basic introduction. And not only that, whenever you're sitting there and having a conversation, don't just wait for the examiner to start. Your job is to start yourself. The minute examiner said your 5 minutes starts now, it's a cue for you to speak up and start with the conversation. Many times I've seen people are waiting for the examiner to say something, and examiner saying, okay, no problem, I understood. So he's giving very simple answers. Try to keep the conversation moving with asking as many questions as possible from the examiner. You can ask, sir, can you tell me about your previous medical history, about your diet problems, about your past history, about any medications you are taking. So whenever you are keeping the conversation moving, letting the patient talk, it will also help you to get as much as information from the patient. When you are getting the information back from the patient, it is going to be very much helpful. You will be able to speak up very confidently, and the more information adds up in your knowledge, the more better clarity is what the situation exactly is right away. The more you talk, the more you are engaging with the patient, it shows that medical professionalism, medically how professionalist you are, how well you are dealing with that condition. And when the patient is he's asking for some pain scale, and he's asking for the pain, and he's asking for the medicines, how well you're giving the answers to it. Ask questions to get to the patient about how to talk. Many times I've seen the patient says that I have stomach ache and I need a painkiller. He has given only simple answer. Your job is to ask him and find out what kind of stomachache he's having. Is he allergic to something? Is there some kind of activity he has done? Did he eat something which was spoiled? Did he eat outside food or home cooked food? Is he, having any kind of relationship right away? What exactly is the patient suffering from gastric trouble? So you have to explain each and every step about the patient and ask him as many questions as possible. The more you will ask, the more it's better that they are going to give you points on how, as a medical professional, you are dealing with the condition. Many times I've seen students saying that, Ankita, when we are talking in our hospital, we say this, we say that, should we continue? Yes. In your hospitals, if you're asking the patient to undergo some kind of therapies or treatments or some kind of test, here also it's okay to mention that. You can say, sir, I would suggest you to undergo the gastric test. I want to see if you're having an allergic. I would suggest you to get allergic test. It's okay to converse it to the patient. It's okay to tell the patient that yes, you have a desire, you wish that patient can undergo some kind of test so that you can get an idea what exactly the condition is. Many times patients say, I think I have cancer. Now he is not sure, but he has somehow made an answer that he is having cancer. You have to be sympathetic towards him. You have to explain him, sir, right now we have the test is still, your test report is still not yet here. We cannot assume on something just because you think the symptoms are same with your brother or sister. Doesn't mean that you are also having cancer. It also means that it could be simple kind of some disease where cancer is not the major part, as when there's cancer, because not every time it is cancer. The minute you think about the negative, the patient might end up expecting the negative. We have to make the patient feel positive, relaxed, calm, and we have to be sympathetic to them. Many times I've seen candidates, what they do is whenever they are, talking, or whenever they are having a conversation, instead of cross-questioning the examiner or cross-questioning the patient, that is he able to understand what exactly is the trouble, what exactly is the issue, they keep on talking, saying that, sir, this is the trouble you're having, this is the medicine will do, this therapy will do. They don't stop. They keep on easily speaking and speaking. It's good. Many people say, Ankita, we only have 5 minutes to complete our task and we have a lot to say. We don't have time to wait for the examiner to answer. At that time, our main first motive is to complete the task, to answer all the questions. I agree, but try to ask the patient always after 4 to 5 lines, sir, is everything you are able to understand everything? Is everything clear? Do you have anything other concerns? Is there any trouble you are struggling from? Keep on asking such questions so that you can let the examiner feel that as a medical profession, you are thinking about the patient's well-being a lot. Well, last but not the least, the secret of success to get A grades, not B, not C, we always focus on getting A, is how well you are preparing yourself, you are practicing on the daily basis, you're working hard and learning from the failures. I have seen a lot of candidates who say that, ma'am, Ankita, we failed last year and now we are not I'm scared not to attempt it again. I understand it's not easy to, come out of a failure, but if you give a chance, you might know what mistakes you have done, and this time you will not be repeating them. So this time the chances are that you will easily be successful in life. Well, I hope I have cleared all your tips and talks on your speaking. Speaking is easy. All your job is to remember if you're speaking in the right, correct grammatical grammar, you're speaking it properly. If you're giving the speaking with the good, correct vocabularies and pronunciation, and not only that, always have confidence in yourself. The more you're confident, that confidence will be shown in your voice. Let's go take a small overview that listening and speaking both need your 24 attention, a great careful concentration. When you're doing a listening, you need to be aware that what to listen, how to listen. And when you're doing the speaking, you should know how to speak, how to converse.
Good evening, all of you. I am 𝗍𝗫𝗓𝗍𝗔𝗠 from Dynamic Health Staff. Now let's have a discussion on OET writing. As all of you know that in OET writing, you will be given a case note based on which you will be writing a letter with the 180 to 200 words. And the case note will contain a patient's details, and the total duration of the test is 45 minutes, out of which the first 5 minutes can be utilized only for reading the task, and then the next 40 minutes can be utilized for writing your letter. Now, let's have a brushing up of the types of letters. There are 5 types of letter in general: referral, transfer, discharge, advice, and information letter. As soon as you get the case note and the writing task, you should be able to identify what kind of letter you are going to write. Usually, the referral letter is written when the reader is not familiar with the patient and you are writing to a new person who does not know anything about the patient. And here you can use, I am writing to refer, or the purpose of writing this letter is to refer, in that way. Then a transfer letter means your patient is being transferred to another facility for continuity of care. Here, the reader may or may not be familiar with the patient. Then discharge letter is written when the patient is going back to a place from where he came to your facility. Usually patient will be going back to back home, or patient may be going back to a nursing home or a retirement home, etc. An advice letter is written mostly to a caretaker, like parents or the son or daughter of a patient, where you want to advise the caretaker about the care of your patient. An information letter is written to inform a particular person regarding your patient and the present condition. So it is very important to identify what type of letter you are going to write, and mostly you will be getting the first 3 types of letters. Next comes the most important thing, assessment criteria. Many of times the candidates are unaware of this criteria. So this is very important to know and to remember, and whenever you write any letter, make sure that you meet all the criteria. Now let's move on to the first one. The first criterion is purpose. As soon as you get the case note, you will be reading the writing task. In the writing task, you will get 2 information. One is to whom you are writing this letter and what is the purpose of the letter. The purpose is the reason for which you are writing this letter, and it should be immediately apparent in the letter, and it should be sufficiently expanded. That means in the introductory paragraph itself, you need to clearly mention why you are writing this letter, and it should be sufficiently expanded. That doesn't mean that always you need to mention the diagnosis, and sometimes some people write a lot of information in the introduction, and that also is not needed. It should be very concise, short, and sweet. Next is the content. The content should be appropriate to the intended reader to whom you are writing this letter. And the most important thing you need to remember is that you need to give more importance to the information which are needed to continue the care. This is very important. Then you need to make sure that all the key information are included and no important details are missed out. Then another important thing is that the content from the case notes is accurately represented. That means here you cannot write any of your opinion or judgment. Next comes conciseness and clarity. Remember that all the health professionals are very busy personnel, and you cannot write all unnecessary information, and it should not be too vast. And what you can do is you can write all the information in a concise manner. For that, you can avoid all the irrelevant information. This is very important. When you get a case note and when you go through the case, go through the information given in the case note, you need to classify or categorize information into three. That is most relevant, less relevant, and irrelevant. And you need to write, you need to give more importance to the most relevant information. Then less relevant information also can be included, but the irrelevant information must be excluded. And how will you decide the relevance of a particular information? For that, you need to remember to whom you are writing and what is the purpose of your letter. Based on this, you will be deciding which all information are most relevant, less relevant, or even irrelevant. Then the given information or the selected information should be summarized and it should be presented clearly. And here certain information can be omitted to make it more concise. For example, some signs and symptoms, then some diagnostic tests, names of diagnostic tests, then the dates of different visits. Then you can write sometimes, if it is not important, you can even avoid the names of certain medications, especially if you are writing to a social worker or any non-health professionals, you need not specify all such things. Then instead of writing each and every detail, you can just write only the important information. Then comes genre and style. Here you must remember that you are writing a formal letter, and it is a clinical document. So it should be, the letter should be clinical and factual, and it should be appropriate to the genre and the reader who is going to read your letter. Even though the person may be a health professional, he or she may not be familiar with the medical terms or the abbreviations used. In such cases, you should make sure to avoid writing abbreviations or technical language, and always follow a polite language, and you need to write formal tone, in formal tone. Next is organization and layout. This is very important. When you organize information, you need to remember that there are three types of organization. That is sentence organization in a particular paragraph. When you write a particular paragraph, you arrange the information in the order of which it happened. Then only the reader will get a logical flow of the ideas. Then again, paragraph organization, where to place a particular paragraph in the letter. That is again according to the priority, according to the relevance of information, whether to write present history, past history, social history, or personal history as the second paragraph. Anyway, you know that first paragraph will contain the introduction or introductory paragraph that will contain the purpose of writing this letter. Then the last paragraph should include a conclusion paragraph, and the signing off is again very important. So that is included in the layout. And when you come to paragraphing, again, there is overall organization is also important. Then the paragraphing, when you write a paragraph, it is very important to include only one or two main idea in each paragraph. If you are including only one idea in a paragraph, one idea, then the explanation of that paragraph, then that idea. Then again, if you are writing more than one idea, the explanation of those ideas can be included in that particular paragraph. Then it should be logical and clear. That is very important. Then you can highlight the key information. For example, like any allergies or something which you want the reader to notice very importantly. In such cases, you can write, please note. Like that, you can highlight the information. Then document is well laid out. This is very important. Layout. That means your letter should look like a letter. That is, it should contain all the necessary parts of a letter. For example, the date, address, then the salutation, the referral subject line, then the introductory paragraph, body paragraphs, conclusion, and the signing off also. Signing off means you are sincerely or yours faithfully, charge nurse or registered nurse or sister in charge, whatever is given. Then if you feel that you will not be able to complete your letter in time, make sure that you are adding that your sincerely part, signing off part. Then only you will get full marks for the layout. Then last but not least, language. As you know that this is a language test, so definitely your language features like spelling, punctuation, vocabulary, grammar, sentence structure will be assessed, and that should be accurate and it should not interfere with the meaning. And now the scoring of this using this criteria, the first criterion, purpose, has got 0 to 3 marks, and all the other 5 criteria have got 0 to 7 marks. And according to your letter, you will be given marks for each criteria. Hope this session was useful for all of you. Thank you. Hi all. Hope the session was really helpful for all of you. Best wishes for your exams. Thank you for watching us.